Hi, everybody. My name is Irene Kang. I'm a medical oncologist specializing in breast cancer at USC's Norris Comprehensive Cancer Center, and I'm honored to be a member of the USC Institute for Integrative Health and Wellness Steering Committee. We are under the umbrella of the USC Office of Religious and Spiritual Life, and we're pleased to present a mini symposium today during the lunch hour on integrative oncology, the art and science of the healing journey. If you're interested in receiving continuing medical education credits, please use the activity code listed here. There'll be a slide on how to access that shortly. We will have a Q&A session after our speakers talk, so please enter that in the Q&A portion of the Zoom meeting. Brief mission statement for USC's IIHW is to promote the health and healing of individuals, families, and communities we serve through the advancement of the practice of integrative health, the science upon which it is based, and the education of healthcare practitioners and the USC community. Our vision is to transform healthcare by establishing a collaborative, holistic paradigm that promotes health and healing and integrates all aspects of human life: physical, emotional, mental, spiritual, cultural, social, and environmental. I'll have a brief slide on land acknowledgement for the indigenous peoples whose land USC occupies around Southern California, specifically the Gabrielino Tongva peoples. And I'm gonna keep this slide on for a second for those who wish to pursue CME credit. This is obtained through the EEDS mobile app. So look for it under your mobile app store and download EEDS. You'll have to create an account and then use the activity code 57KAKI. So I'll leave this slide on, but our next slide is just going to be a brief acknowledgement of all the on-scenes and behind-the-scenes members of the USC Institute for Integrative Health and Wellness who serve on our staff and steering committee listed here, who have been involved in bringing both this symposium today as well as all the other activities aimed at achieving our mission and vision. And coming to a screen near you, our next quarterly symposium, please look forward to this. It is going to be on integrative mental health. We're looking to launch this in May, and this will be including CME credits. Please look for more information either via email or our website, integrativehealth.usc.edu. Without further ado, I am going to launch in and introduce our speakers. So I'm very pleased to introduce, first up is Dr. Mary Hardy. She's a board certified internal medicine physician and specialist in botanical and integrative medicine. She has actively combined complementary and alternative therapies with traditional Western medicine for over 30 years in both her clinical practice and research endeavors. Dr. Hardy truly has many accomplishments, too many for me to review here in whole, but I'll give you a brief summary. In 1998, Dr. Hardy founded the Integrative Medicine Clinic at Cedars-Sinai and participated in NCAM-funded research related to integrative medicine. Her research career has also brought her to serve as an associate at the RAND Corporation, where she developed extensive expertise in evaluating the efficacy and safety of complementary and integrative medicine. Her research interests include natural therapies, evaluating their safety and efficacy, especially botanicals, as well as conducting clinical trials of dietary supplements and lifestyle choices to reduce toxicity and to improve outcomes of conventional cancer treatment. I'd be remiss to not mention that Dr. Hardy is the past medical director of the Sims-Mann UCLA Center for Integrative Oncology, and she's a recognized leader in the field. She's also served as a board member of the Society for Integrative Oncology and numerous other important entities in the field of integrative medicine and herbal natural products. We are delighted to have her speak with us today, and her talk is titled Integrative Oncology, Better Outcomes for You and Your Patients.
I want to thank everybody for participating with this. This is a an area that's near and dear to my heart, because I think that the benefits here are so excellent for patients and for uh, practitioners, that I'm very grateful that you're giving me the chance to tell you about this. I'm also happy and kind of chagrined to tell you that there is much more data than can fit into this slot that I've been given. So what I'm going to do is, I think, answer some or address some basic issues that people generally have with integrative oncology, give you a taste for what's available in the literature here, and then be really happy to answer questions. Okay, so now, I think the first place to begin here, and to be incredibly clear about this, is that this is not alternative medicine. The greatest risk in this area is not for a supplement with radiation or a diet or exercise with chemotherapy. The greatest risk is using something not conventional medicine for cancer treatment. And that has been shown in a number of studies. So this is just looking at one study that looks at the life expectancy of breast cancer patients on the B side here, all cancer patients here. And you can see the Cox curves separate quite early in treatment, and that the difference in life expectancy continues throughout the time that was measured. I have done an extensive review about 10, 15 years ago, trying to look for evidence of harm while also looking for evidence of benefit, because I wanted to have a balanced discussion about this. This has been published in the Hematology Oncology Clinics of North America. This whole issue looks at integrative oncology, so I recommend it to you, even though it's a bit old now. But at the time that I did this, and this was an 11,000 word article, I could find very little evidence of harm. But I did find evidence of benefit. And I think that is not a bad mindset in which to approach these therapies. These are generally safe therapies. They're generally effective therapies. And for most people, you'll find that the benefit outweighs the harm, especially if you're choosing carefully and using high quality products. This is a much more recent look at this, looking at micronutrients in oncological interventions, specifically things like antioxidants and things that get a really bad rap. And you can see from the quote that I pulled out that the evidence has been increasing, and that as the evidence increases, that there is evidence that patient compliance improves, that there's a lower rate of treatment discontinuation when micronutrients are added appropriately to a patient's therapy. Let's look now at the definition, now that we've gotten out some of the basic harms and the balance I think that's appropriate to think about integrative oncology. So here's what the definition looks like. Integrative oncology is a patient-centered, evidence-informed field of cancer therapy. It uses a variety of practices and lifestyle modifications alongside conventional cancer treatments. That's incredibly important. If patients are hearing about these therapies not from someone who's well integrated into the cancer team, will often not be to their benefit. And these therapies are useful throughout the full continuum of the cancer patient's experience, from prevention, primary and secondary, through active treatment. I'm going to talk most about that today. And then also in the cancer survivorship. And the number of cancer survivors that we have is growing exponentially. I think it's over 10 million people now. So there's a lot of people that are be interested in this and that are available for these benefits. This is how the balancing act usually goes. We're looking at lifestyle modifications, mind body practices, natural products, all three of these broad areas. And we're balancing that against the patient preferences, values, and rights. People have a right to choose what works for them. Often in ethnic populations, you'll find that what we call alternative or not mainstream is actually very often utilized in mainstream practice, and that this is research evidence informed. Of course, there's not enough evidence to prove this stuff reliably. There just isn't always enough evidence for anything, but you also balance that and temper it with your clinical experience. These are our goals. I'm not going to read them out loud to you. I think that they are fairly self-evident. I'm going to just focus on this: increased patient empowerment. I think how you communicate with patients, the willingness that you have to let them raise issues that are important to them, because often this interest in integrative or medicine or integrative oncology will come initially from the patient. So you need to give them enough time to tell you what they're interested in, let them show you what they're interested in, and then with those bona fides in place, you can then allow them to participate in the actively in their own treatment. The more that the patient feels like they have some ability to affect what's happening to them, the more they're going to be steady in their treatment, the more they're going to be actively participating, the greater the reduction in psychosocial stress. And I've heard cancer treatment described as the worst roller coaster ride of your life. All the news is bad. You never know when the next big turn's going to come, and you don't have any steering in that little cart. So if we give patients that opportunity, they're going to feel a lot better about the outcome. And I do think you're going to see a decreased interruption in treatment, or a decrease of intensity of treatment. Prevalence of CAM use globally. This is kind of a marker for integrative oncology because we haven't really yet gotten a lot of epidemiologic studies looking at the measurement of integrative oncology. This is the formation of this field is relatively young, but you will see that the use of CAM is very common. These three areas are sort of the Western areas that are utilization here will be, I think, applicable to our communities as well. And you can see that the greatest utilization is in North America, and that utilization over time is increasing. And so I think that's something to keep in mind. I'm sorry I don't have the citation on this slide, my oversight, and I'll get that before I give my slides to the presenter to share with you. But this shows that even in underserved populations and lower socioeconomic populations, the interest in integrative medicine is high and utilization is high. Even where people are spending money that they don't have, or that they don't have a lot of, this is so important. They'll dedicate this they'll dedicate themselves to using these things. And these are the kind of areas that people are looking at and utilizing to look for improvements. Again, a broad variety of areas are available. And I think we're going to hear from two of the best evidence supported areas a little bit later: exercise and acupuncture. The most common therapies that are used, I think if you ask most integrative oncologists, or if you ask most oncologists, they're going to feel most comfortable down at this end of the pool: yoga, meditation, music therapy, etc. The mind-body interventions, because they don't want to interfere with their own therapy, which they know is quite toxic. However, let's be honest, most people are interested in using this end of the field: the vitamins, the minerals, supplements, etc. So we have to be prepared to meet patients where they are and have a coherent discussion with them about benefits, risks, and finding the right supplements. I want to highlight this as the beginning of talking a little bit about integrative oncology in more detail, and some of the interventions that have been shown to be helpful, because this study excited me greatly. It literally just came out hot off the press, and it's looking at a large group of integrative oncology services, practices in academic settings mostly. There were 103 of them. They rated them about how integrative their integrative oncology was, how integrative their oncological services were. And they ranked them from low to high. And they found that if they compared the medium high to the high integrative organizations, that their patients did 3 times better in survival, not a soft endpoint, a very hard endpoint, and they did better than the lowest integrative groups. And I recommend this article for you all. It's a terrifically exciting. It's the first time what many of us have suspected or seen anecdotally that we're now seeing in a more organized setting. If we're going to look across the whole broad spectrum of integrative oncology. This is a paper that looked at integrative oncology consultation initiation in an academic setting. And you can see that up here were the primary things that were talked about. And then this is looking very, very quickly at integrative medicine interventions or integrative oncology interventions for symptom control. And it focuses very well on things we're going to see: exercise, acupuncture, etc., sort of the end of the pool that I showed you on the right side. But it doesn't focus a lot where I think there still is good evidence for dietary supplements. So I'm going to take the last few minutes I have, and I'm going to talk to you about that. Now, this is again looking at the large review I did that I showed you before. It's 2008, so it's an older review now, but it shows that there was evidence for ginger nausea, fish oil for cancer cachexia, also branched chain amino acids for cancer cachexia, a condition for which we have very poor interventions conventionally. Glutamine, vitamin E, melatonin, medicinal mushrooms, etc. These have all been tested and been shown to be efficacious. Black cohosh, for example, there is a year-long study done in Spain looking at black cohosh helping handle menopausal symptoms in breast cancer survivors with good benefit. And so again, there's not a lot of robust data, but there are studies that are long and large. And I'll show you some of these while we go through. This is one of my very interesting studies, I think, that I've depend on a lot. This is looking at curcumin, which is the component from the root turmeric. It's in the oleoresin, the oily part of the root. It causes that bright yellow color that you see in turmeric if you look at the root raw, or if you see it the capsules, or you see it in any other way. This is a specially prepared curcumin. It had a phytosome added to help solubility and therefore absorption, bioavailability, because the curcuminoids are not very dissolvable in water or even in oil particularly. This was a study looking at 400 patients. It was performed by the company Helsinn that makes Aloxi. They were very committed to symptom management in patients, and they started to look very deeply at complementary medicines that might be helpful for that. So it shows benefit in nausea, vomiting, fatigue, weight loss, and memory and cognition improved. It was a randomized controlled trial. It ran for 2 months, and it shows for most of these conditions that benefit accrued over the 2 months. For example, nausea and vomiting, malnutrition and weight loss, probably through its action on inflammation, and then memory function as well. This same material was also, this is a chemotherapy part of the trial. The trial was also done in X-ray, radiation therapy patients, showed benefit as well. But I want to show you this, because not only is there data that shows benefit in nausea, vomiting, diarrhea, constipation, etc., but there's also evidence for, again, really hardcore endpoints: sepsis, neutropenia, platelet count, toxicity in core organs. And these are places where we often see toxicity of our therapies. And medication utilization was significantly less in the treatment group. This is one pill, 500 milligrams a day. That's a very modest intervention, not overwhelming for patients, with significant benefit. So all these interventions don't have to be complex, multiple product interventions, measurable effect. Something as simple as honey can be useful to decrease the severity or the prevalence of mucositis in the mouth. Easy, people have it, it's a food. And so I often encourage patients to use this in the day before, in the 5 or 6 days right after chemotherapy, for those agents that cause mucositis. Can be very helpful for that. And it's sweet, so again, it's not a hard sell. Again, zinc, anywhere from 25 to 50 milligrams 2 to 3 times a day, was helpful in head and neck cancer patients with the severity of mucositis and dermatitis on the skin. Not a complex intervention. Glutamine dosages, and I'm not going to go into doses, it varies by trial, but very helpful with diarrhea in patients who are getting chemotherapy. Again, not a complex intervention, relatively useful. American ginseng for fatigue. This was done in breast cancer patients. Chronic fatigue or fatigue following therapy, as you all know, is a very common condition, and it can be really debilitating. And for the 20 to 30% of patients who have persistent fatigue after chemotherapy, it can be life-altering. This shows the intervention starting at the time of chemo and adding American ginseng, 2,000 milligrams of the root extract, showed a decrease in fatigue. And also it showed that if this material was started after the initiation of therapy, when people started complaining of fatigue, it was less effective. So I think I might be barely under my 20 minutes. That was a quick romp through this. There are lots of other therapies, and there are lots of other techniques and ways to use them. But I hope this piqued your interest. I hope this showed you that safety is not as overwhelming a concern as it's advertised to be, and that benefit can be attained even with simple therapies. And I'll take questions later on when we get to the question and answer section. So thank you for your attention.
Fantastic. Thank you, Dr. Hardy. I learned so much just in that short period of time and can't wait to look more into this fascinating field. Next up, we have Dr. Marisa Perdomo. Dr. Perdomo is a board-certified oncology physical therapist specialist and an assistant professor in clinical physical therapy at USC. She has over 35 years of clinical practice focusing on orthopedic, oncologic, lymphatic dysfunctions, and integrated health. She received both her master's and doctorate degrees at USC and developed a physical therapy practice for cancer survivors at USC. She also has certifications in lymphedema, cancer. She's a cancer exercise specialist, a Kundalini yoga instructor, and a certified Reiki master. Her academic interests focus on oncology rehabilitation and management of peripheral edema. Without further ado, we'll introduce Dr. Perdomo for her talk on mind-body practices.
Hello, everyone. Welcome to our symposium. My talk is on mind-body therapies with the focus on exercise. And I say, as a physical therapist, I am very passionate about exercise, but I also want everyone to know that my own experience with cancer and its rehab program is also driving my passion for integrative medicine and specifically exercise and mind-body therapies for healing, not just recovering, but for healing. So hopefully everyone will agree with me that we now know that exercise is medicine. It's just not, we can't take it in a form of a pill. And we're very fortunate at this present time to have a plethora of good, strong research over the last 20 to 30 years outlining the benefits of exercise. And exercise traditionally is aerobic exercise and resistance training. However, we now have good evidence that these mind-body therapies produce very similar physiological effects, benefits that are traditional exercise programs. So I'm going to start with the findings from the American College of Sports Medicine expert panel. So the first publication was in 2010, and they've written guidelines and recommendations and have updated them recently in 2019. It included many healthcare professionals, physical therapists being very involved. So the evidence does show us that in survivors of cancer, aerobic exercise program performed 3 times a week helps improve significant improvement in anxiety, depression, fatigue, physical function, and quality of life. Resistance exercise has also been shown to show improvements in this chronic related fatigue or even short-term fatigue that cancer survivors experience, physical function and quality of life. And when the individual performs the two together, the response is even greater. So the first question is, from a physiological or a body perspective, why exercise? And you may hear the term, we use mind-body exercise or movement-based interventions, because as we're going to go through this presentation, there's lots of types of exercises. But exercise does improve many of our cancer-related toxicities. So deconditioning and poor cardiopulmonary fitness is a huge problem for individuals who have received surgery, radiation, chemo for their cancer. Exercise, although it doesn't happen overnight, but it's very effective. Exercise can decrease cancer-related fatigue. It addresses the musculoskeletal dysfunctions, especially if you think after surgery, the soft tissue and muscle and joint restrictions. Exercise can improve balance due to chemotherapy-induced peripheral neuropathies, and it helps to prevent falls or decrease the falls risk. Many individuals experience what we call chemo brain, or difficulty in cognition, memory, learning. Exercise helps improve that. And the other ones we just talked about. So those are the general toxicities. But exercise as a modality to help us heal, the evidence does show, and this was a significant recommendation by the ACSM panel, that after a diagnosis of breast cancer, colon, or prostate cancer, if that person exercises on a regular basis with specific parameters, it's associated with longer survival times. So the next question that comes to mind is how much to exercise? So we talked about this 3 days a week of aerobic and 2 days a week of resistance. The minimum is 30 minutes per session for aerobic, 30 minutes per session for resistance exercise. But the other component I want to bring up is how difficult should that exercise program be? So the ACSM is recommending, and so is the Physical Therapy Association, 150 minutes a week of moderate intensity of exercise. And that is going to, moderate intensity, you might think of a target heart rate range, but that's going to be very individual for each patient, depending upon how deconditioned you were, if you had a strong exercise history before the cancer. But moderate intensity could be anywhere from 60 to 75% of your target heart rate max, but that will have to be determined by your healthcare professional. But what was also interesting is they defined 150 minutes per week of moderate intensity, or 75 minutes of vigorous intense exercise. So again, there is a range, and that range has to be individualized for each person as they go through the cancer care continuum. So the next question is, when we talk about when and what type of exercise is beneficial. Well, exercise is beneficial across the entire continuum of cancer care, from prevention to diagnosis to in treatment to short-term recovery, long-term recovery, and then throughout that individual's lifetime during survivorship. So we talked about, everyone's very familiar with traditional exercise, your aerobic, your bicycle, you're running, you're walking, you're doing some sort of dance exercise, and then we have our resistance training. When we talk about mind body, I think most of us are familiar with yoga, Tai Chi, Qigong. There are other slower movement types of exercise. But I also want to point out that yoga can be very gentle or can be very vigorous. So once again, where you are on that continuum and where your level of fitness is, the yoga program has to meet that level. But I also want to bring up something as simple as breathing and meditation. In my mind, that is a form of exercise. Breathing can have some of the same physiological effects that yoga has and that running 3 miles has. And part of that is our neurohormonal physiological responses to exercise. So even if someone is undergoing chemotherapy and they're quite challenged physically, using a mindfulness meditation approach, combining with breathing exercises, repeating a mantra, all those things can lower your heart rate, lower stress, lower anxiety, and have positive physiological benefits, not just on the body, but on your emotional and mental state. And people typically don't think of breathing or meditation as an exercise, and I want to raise that awareness. You still have to do the physical part though, but it just depends on what phase, what stage you're in. So when we think of mind-body exercise, again, we are targeting all components of the mind, body, and spirit to achieve wellness. And I put here a couple of definitions. Maybe a much older yogic approach was that mind-body practices work together to shift the awareness of practitioners away from the mind and self and toward a more true understanding of the world. And that's, we've progressed beyond that. In 2003, it was described as a group of therapies that emphasize the use of the brain in conjunction with the body to assist healing. And that is much more representative of this paradigm. And in 2018, mind-body practices or exercise were defined as techniques that focus on the interactions between the brain, mind, body, and the individual's behaviors, and on the way in which that individual's emotional state, mental health, social involvement, spiritual beliefs, and behavior directly affect health. So that is much different than just saying, okay, go do 3 sets of 10 of this exercise. This is truly incorporating the entire person, all aspects that make us human, to promote health and wellness for individuals recovering from cancer. Now, I'm not going to go into detail, but I just wanted to really emphasize the impact of research and what the research on these mind-body therapies. And so as an example, yoga, mindfulness meditation, breathing techniques have all been shown to have a positive effect on decreasing pro-inflammatory biomarkers in our blood. And really briefly, when we are in a stress, we call it fight or flight, when we are under a stressful situation, it is our sympathetic nervous system that is governing our body, and that results in an increase in heart rate, an increase in blood pressure, an increase in respiration rate. And these mind-body techniques move us out of that fight or flight mode and into what we call parasympathetic housekeeping, a calmer state for our body. So that cascade of consequences of being in stress is reduced when we perform yogic breathing techniques, some form of meditation, and then forms of yoga. There's also evidence increasing in the past 8 to 10 years that these mind-body therapies influence gene expression. Again, the genes that produce these or promote these inflammatory processes can be decreased through these mind-body therapies, improving our immune system response, our white blood cells. Cancer patients are often immunocompromised. They may not have the normal white blood cell, neutrophil cell response. And we have some evidence now, some pilot studies and larger studies are being done, that we definitely have an increase in production of immune system cells when we exercise, when we breathe, and when we meditate. And again, I'm giving a plug for David Black from USC and Dr. Levetsky from UCLA and their work on looking at tumor necrosing factors, looking at, in this case, white blood cells, leukocytes, looking at a very specific yogic meditation called Kirtan Kriya. and it's through the Kundalini yoga approach, and its effect on the enzymes that can control the telomeres, which are just on the end of our chromosomes, kind of like the eraser on the tip of a pencil. And that has to do with improving our physiological cellular ability to respond to stress and aging, cellular aging. So a systematic review by Lynn in 2018 looked at cancer treatment-related toxicities, and 25 clinical trials met the criteria for the study. And again, definite positive benefits in yoga. And remember, yoga is the physical activity part. It has very definite breathing components, breathing techniques, and then there's meditation. And I should say there's also time in a yoga set for recovery. And it had definite positive benefits for sleep disruption, cancer-related fatigue, those cognitive impairments and memory impairments we talked about, psychological distress, anxiety, depression, and then the musculoskeletal systems. And they're even getting a little bit more sophisticated in trying to determine the best dosage, how much time per week should you do yoga to achieve this benefit. So as we're going through the continuum of care, I want to remind everybody that mind-body exercises and traditional aerobic and strengthening exercise programs can be used together to support the individual going through cancer treatments and through survivorship. But we do know that some of these treatments can have detrimental effect on the heart, on our lungs, on our neurological system, on our muscles and joints. And so before we start any exercise program, we need to get advice from evaluation from your physician. And I would also like to recommend an evaluation by the physical therapist. There are some musculoskeletal problems that should be treated by a physical therapist and not just by going to some random yoga class. But I want to emphasize it's the combination of both approaches that can be highly beneficial for individuals, but it's just picking the right exercise program at the right time. The wonderful thing about mind-body exercise is everyone can breathe and everyone can meditate and everyone can do simple movements, very gentle movements throughout the entire spectrum of care. In summary, I want to remind everybody that breathing and meditation can be part of an exercise. They are exercise. That mind-body exercises, again, are appropriate across the entire journey from diagnosis through survivorship. That exercise improves many of the cancer-related toxicities. And it's important to note that in a study, a little bit old, but was in 2008 and then again in 2010, 5 years after women recovered from their breast cancer treatments, over 30% of them still had musculoskeletal diagnoses that were having some impact on their daily function. And as a therapist, as a cancer survivor, I find that unacceptable because we have many things to help those individuals have a better quality of life. It's not just about function. If someone has to give up a passion because of physical limitations, that's not acceptable. We want to address that. Exercise improves mental health and a sense of well-being. And going back to that physiological responses of it, there is a reduction of systemic inflammation in the body. Remember that cancer is an inflammatory disease. And just as Dr. Hardy was talking about nutrition and foods that would help decrease inflammation, exercise, breathing practices, meditation practices also help reduce systemic inflammation, which is very important for someone diagnosed with cancer. And by helping people get out of that fight or flight or that sympathetic nervous system control. We can help reduce blood pressure, reduce resting heart rate, and reduce respiration rate, and overall give a better sense of well-being. I just want to give a plug for my esteemed colleagues, Dr. Kimmy Yamada-Hang and Dr. Minnie Jang, who are over at the USC Physical Therapy Associates Clinic. And I hope that from today you realize that exercise not only changes your body, it changes your mind, your attitude, your mood, your heart, your soul. And thank you very much. I know it was a whirlwind brief introduction, but I'll turn it back over to Irene and we'll answer questions during the panel.
Thank you, Dr. Perdomo. Fantastic to learn about really quantifying the benefits of exercise in mind, body, as well as really understanding maybe some of the mechanisms behind this. Next, we are so pleased to have Aaron Cook present. He is a licensed acupuncturist and practitioner of traditional East Asian medicine, specializing in pediatrics and integrative healthcare. Aaron began his study of traditional medicine in 1999, earning a Master's of Science of Traditional Oriental Medicine degree from the Pacific College of Oriental Medicine. Mentored by Alex Tiberi, Aaron developed skills in pediatric acupuncture, and he is passionate about integrative medicine and healthcare for the underserved. Aaron has taught pediatric acupuncture at the Pacific College of Oriental Medicine and served as the director of the acupuncture service at Rady Children's Hospital in San Diego. He's also worked at UC San Diego in the student-run free clinic, as well as a founding member of the UC San Diego Center for Integrative Medicine. At UCSD, Aaron served as the director of acupuncture and massage services and director of community partnerships, and directed courses in integrative medicine for medical students and residents. He currently lives and works in Tucson, Arizona, where he teaches at the Arizona School of Acupuncture and Oriental Medicine. His talk today is titled Integrative Oncology, the Role of Acupuncture and Traditional East Asian Medicine.
Thank you all for having me here. I'm super excited to be here with you guys. I want to talk to you guys about like the role of traditional East Asian medicine. I'll probably like fall into the speak of saying traditional Chinese medicine or traditional Oriental medicine, but traditional East Asian medicine and the role that it has in integrative oncology. I'm excited to talk to you guys today. So one of the first things I like to talk about is the roots of traditional East Asian medicine. And how I kind of got into it. When I started my career, I was doing pre-medicine and wanted to become a family medicine doctor. And I decided that I wanted to become a Chinese medical doctor and basically got into this kind of weird stuff. So the roots of the philosophical roots of traditional East Asian medicine is a holistic and wellness-oriented belief. We kind of think of things a little bit more organically and synthetically, and we look at the macrocosm in relation to the microcosm. And we're also interested in the wellness of folks. So we look at both the body, mind, spirit, the harmonious aspect of social and natural relationships in terms, so it's sort of how individuals are interacting with their external environment. It's an integrative medicine concept. It's patient-centered and humanistic. It's interesting that it's harmonious with both integrative medicine and traditional East Asian medicine. So these things both kind of line up. Like it's an empowerment model. It's a holistic approach. I'm sorry, I'm like kind of trying to go through this fast because we don't have a whole lot of time. These are the practices of traditional East Asian medicine, and it goes backwards. It starts at the bottom with acupuncture, herbal therapy, which are what most people kind of come in um, for their therapy. But it actually starts with diet, nutritional therapy, exercise, and massage and acupressure. Um, I want to kind of go back, like my introduction into Chinese medicine, traditional East Asian medicine, and integrative medicine started in about the year 1999. And I was very interested in becoming a family medical doctor and basically basically doing medicine. And then I came upon acupuncture and traditional Chinese medicine, and that seemed a little bit more interesting. So I decided to study that. Um, I I started my study with my teacher Alex Taberry, who was an acupuncturist and a pediatrician, and became interested in holistic health. And from that point, I started to study traditional Chinese medicine, and excuse me, and I, I became interested in integrative medicine because when I started to study Chinese medicine, it it was known as complementary and alternative medicine, so it was a little bit outside of the mainstream of our 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 healthcare network. Um, it became like apparent that it was important to kind of like incorporate integrate these systems together, and I started to work on integrative medicine. And in the context of that, I became the director of the acupuncture service for the Rady Children's Hospital at in San Diego, and started to work on on um, oncologic medicine. Excuse me. And during that process, I learned how to incorporate like these two worlds of both Chinese complementary Chinese medicine um, and conventional oncologic medicine. Um, it the 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 excuse me, I'm going to back up a little bit here. Um, excuse me. So what I would like to talk to you guys about today are the sort of the therapeutic practices of Chinese medicine and how we can incorporate that into our modern oncology setting. Um, the main aspects of Chinese medicine are going to be diet nutritional counseling. Essentially, these are ways of incorporating natural ways of eating with our life and incorporating therapeutic foods into the therapeutic process. We incorporate exercise therapy in Chinese medicine, including Tai Chi, Qigong therapy. These are like very kind of relaxed forms of exercise, which are appropriate in these settings, especially for oncology therapy. Um, Tuina massage and acupressure therapy are a big part of Chinese medical therapy. Chinese herbal therapy is something we'll discuss, and then acupuncture is like a main type of therapy that we're going to discuss today in terms of oncology setting, integrative oncology. Acupuncture is a very safe and effective method in treating patients who are going through oncologic disease. There's a very rare occurrence of adverse events. Clean needle technique is something that we practice every time that we treat a patient. We use sterile needles. We make sure that people are safe in the delivery of acupuncture care. One of the main things I want to talk about today are the benefits of acupuncture for oncology patients in terms of acute care, survivorship, post-acute care, and palliative care. And then we'll talk about the main things that we can help with. In terms of acupuncture for oncology, one of the main things we treat is pain, and this can be helpful both for acute care patients going through chemotherapy, radiation, etc. We can treat like things like side effects of those treatments, as well as the pain from the oncology specific complaints. Nausea and vomiting are one of the big things that we treat with acupuncture and Chinese medicine, and that's something that both with acute care, chemotherapy induced nausea and vomiting, and as well as post-operative nausea and vomiting, we can help with that. Neuropathy, there's a lot of evidence in terms of the effects of acupuncture for chemotherapy-induced neuropathy, as well as other types of neuropathy. Xerostomia, the dry mouth that people tend to get from treatments associated with acupuncture or associated with cancer care. We can help with that. So there's a lot of evidence for those first 4 areas we're talking about. The stress, anxiety associated with cancer care, we have a lot of experiential evidence that acupuncture is very helpful with that. And sleep and with digestion, acupuncture is also helpful. I think the big picture with acupuncture is that it helps to regulate the nervous system. So you kind of decrease sympathetic activity, so that stress response that people get is decreased with acupuncture, and the parasympathetic activity is increased. So you get the rest and digest increased with acupuncture. So essentially what we're trying to do is bring balance with our acupuncture treatments. And if these are some resources that you can access to gain further research, the American Academy of Acupuncture, Medical Acupuncture is a great resource. The Society for Acupuncture Research is a great resource. NCAM, a great resource for research as well as researching particular practitioners. And the California Acupuncture Board, if you're in California, is a great resource for researching particular practitioners. Acufinder.com is a great way to find practitioners in your area. So if you have questions after this, please ask, and then thank you for your time, and hopefully that was okay.
Fantastic. Thank you, Erin. So this concludes our set aside time for speaker series, but we'd like to jump into question and answer for those of our audience who are available to stay after 1 o'clock. We will be accepting question and answers until 1:30. I will start with, we have actually quite a bit of activity in the Q&A section already. I think this has come up a couple times in the questions, but really, how do patients broach this topic of being interested in integrative medicine with their treating providers, a medical oncologist? Maybe if Dr. Hardy wants to take a first stab in anyone else can be certainly welcome to comment as well.
Sure. I'm happy to be the first person into this pool because I think it's really important. And my answer is not exactly, it's coherent with the question, but it's answering in a different way. I don't think this is primarily the patient's responsibility. I think it's our responsibility to ask and make it a friendly, safe environment for them to share. There's a couple of techniques, of communication techniques that are good here. The first thing to do is something what I like to call a general disclaimer, which gives permission, and then ask an open-ended question. For example, I know my patients are very interested in helping themselves and do that by using dietary supplements or other therapies. What's your experience? So I've told them I know about this. I'm not freaked out about it, and I want to know what you have to say about this. And it's true that many patients feel intimidated by their oncologist. They feel afraid to share with their oncologist because they feel that if they disclose that they're using unconventional medicine, even if it's in conjunction with their conventional treatment, they think their oncologist will fire them or be judgmental or be very negative. And that's just a tragedy because it's a real missed opportunity to give good information to further cement your patient-physician bond or your healthcare practitioner physician-patient bond, and to really get the best treatment for your patient, which I think is definitely a both and stance. If the patient really has to bring it up, then I think they need they may be able to do the same thing and say, you know, I know that lots of oncologists don't agree with this, but I'm really interested in taking curcumin to lessen my symptoms. What are your feelings about this? They can just turn it back on their doctor. But it does take a lot of intestinal fortitude to do that for lots of patients.
Yeah, thank you, Mary. Any other thoughts maybe from Erin?
Yeah, I think you just have to, like Mary said, you have to speak up.
Yeah, I'll just comment as a healthcare provider. I think most of us know that, you know, these therapies are of high interest to a lot of patients. And so I agree with Mary, it should be normalized. It should be brought up so that, you know, the burden is not on the patient. But even if a patient does bring it up, you know, you're just letting your provider know what's important to you. And that's really one of the foundations of a therapeutic relationship.
Right.
So thank you for your input.
Dr. Kang, I would like to also add, as a physical therapist, we spend a lot of time with our patients, and this comes up a lot in discussion. And so one of the techniques or strategies, I'll say, well, what are you interested in? Let's go to Google. Let me help you find some good research articles or summary so that you can go into the office with the doctor and say, hey, you know, what do you think about this? I also ask them if they're comfortable, if there's a nurse practitioner or a nurse or a physician's assistant. And if they're uncomfortable, maybe bring it up with them first and, you know, talk with them. And then they can also be an advocate for that patient and help make them more comfortable bringing it up with the physician.
And Irene, I'd just like to step back in for a minute because Marissa's suggestions are great. Find any open door. That's a great way to look at it. But I also want us to look at ourselves for a second. Many physicians don't bring this up, or many healthcare practitioners don't bring this up because they feel, I don't know anything about this. They're going to ask me a question I don't know the answer to. And on rounds, that was always a kiss of death. If you didn't know the answer to something, much shame would soon be involved. So I guess what I have to say is that your honest reaction to your patient, just your interest and willingness to hear, is as important as your concrete answer. And patients will always accept, let me find out about that, and I'll get back to you the next time I see you. Or, you know, I'll get back with you when you can talk to the nurse. She'll tell you what I've decided or what I've found out. So don't be intimidated by your own newness in the area, because patients are often the best teachers in this area as well.
That's a really good point, that really from the healthcare standpoint. And thank you for really educating our community and helping us to better bridge that gap of knowledge. That, yeah, absolutely, healthcare providers feel uncomfortable because we don't know what's going on sometimes. We don't know how to guide patients in this. And that leads me to one of the questions asked: how do I find an integrative provider, either or on behalf of my patient, or if I am a patient, how do I go about finding an integrative provider and connecting with someone who knows the data, knows how to integrate really into Western cancer therapy, and will work with, let's say, my oncologist or other providers?
I have two suggestions. The first one is our word of mouth. So oftentimes, if you found an acupuncturist, they'll know about a provider, etc. Sometimes your oncologist will, and that will be helpful if that's the case. But two organizations that will be useful. The first is Society for Integrative Oncology, the SIO, and they will tell you about their members. Also, the websites for most of the NCCAM Cancer Centers of Excellence will say on their website if they have integrative oncology providers participating in all these different modes of practice as well. Also, another organization is the AANP, and I think it's the American Association of Naturopathic, ONC-ANP, Oncology Association of Naturopathic Practitioners, naturopaths. So they also, and I can get the exact wording of that, but they also can be, they usually take an extra year of training after their school finishes, pass an exam, etc. So there's a bit more rigor there for people who are interested in looking for naturopaths who may know, who do know a lot about this as well.
Thank you. And I know Aaron had listed some trustworthy websites to find an acupuncturist in his presentation.
Yeah.
Anything else to add? Yeah.
Yeah, no, I echo everything Mary just said. And then you can look at those websites, and then do your due diligence, and then call those folks that come up on those websites and ask a couple questions, and make sure you feel comfortable with them and that they're licensed. You can also look up the state licensing boards or the national licensing boards for acupuncture.
Mm-hmm.
Thank you. And Mary, you mentioned NCCAM, and that's the division of the NIH that is.
No, I was talking about the Cancer Centers of Excellence, that there are, I don't know, 100 Cancer Centers of Excellence in the United States, and every one of these Cancer Centers of Excellence has on their website, they'll tell you. So if you go back to the place you want to go practice, you want to go get your therapy, you can look on the oncology website and see the oncology center website. Do they have any kind of additional practitioners or additional expertise in this area? And now more than 75% of them do. So even the most rigorously tertiary care academic centers are realizing that this is a necessary specialty to include, both because patients are interested, but also because it affects the outcomes favorably, usually, of cancer treatment.
Great. And perhaps related, Toby Fischel is asking what next steps we should take to become an integrative oncology clinic and hospital. I suppose she means here at USC and Norris. Patients are asking for this, and I can attest to that. And we know that patients have more ease and do better with this offered. Any ideas from the panel? Otherwise, we can kind of take this as, it actually has been a longstanding goal and mission within IIHW. Maybe we'll hold on that and get back to that after a few sort of more objective questions. One question for Dr. Perdomo is acupuncture, oh, actually, sorry, Dr. Aaron Cook, acupuncture, is it safe for lymphedema patients? Maybe it's a crossover since your areas of expertise overlap.
we can both answer that question. It's safe within guidelines. So you want to find somebody that has expertise and knows what to do and what not to do. But it's safe within guidelines and with somebody who knows what they're doing.
So, Aaron, is there an increased risk of infection? I think that's what people are mostly concerned about with needling into into all that stasis.
Yeah, you have to be careful with needling into the local areas where lymphedema might be happening. And then, kind of, you can do various techniques to help, but you have to also manage the risks.
Okay, that's interesting. Thanks.
Yeah. And
Dr.
if you find
Perdomo,
somebody that's got expertise and that has training, like it's similar to like lymphatic massage with folks with lymphedema. Like you want to find somebody that knows what they're doing and has expertise.
Dr. Perdomo, maybe you can comment on other therapies for lymphedema that are available to patients.
Oh, well, yes, I will do that. I was also just going to echo, it's that fear of infection, with putting the needles into a limb that does not have good lymphatic circulation. However, I've been treating cancer patients for over 30 years, and a majority of them get acupuncture. And the ones that have lymphedema, in speaking with, and Aaron can comment on this as well, there are other meridians and acupuncture points that are not in the involved limb that are going to help improve lymphatic circulation and blood circulation. So when any doubt, use those other meridians, talk to your acupuncturist. They know it, but they can use those points and you can still get a benefit that way. Other therapies for lymphedema, I would like to say that I was part of the first clinical practice guidelines for physical therapists and lymphedema. And compression therapies, appropriate compression, and exercise have definite positive benefits. Treating it as early as possible has the best outcomes. But that means that we have to get the physicians to refer the patients to physical therapy before they have lymphedema so that we can evaluate and screen them, which will give us a better chance of treating them early and keeping the limb the same size. In many cancer centers across the United States, you have lymphedema specialized clinics, but there's many centers that don't even refer until after it starts, as an example.
I think that's very common to refer after there are clinical signs and symptoms of lymphedema. Can you maybe help us understand what's the patient that we should prophylactically refer to physical therapy? So who's at high risk?
Yeah, so the highest risk factors are for individuals who are going to have axillary node dissection, who are going to have radiation, especially if it's in the axilla, who are going to be on taxane chemotherapy, and who have a high BMI. And so those are some of the top 4, I think, risk factors. If a physician if you know already during your treatment planning that they're going to get taxane chemotherapy, they're going to have an axillary or have an axillary node dissection, or they have a higher body mass index, they could be referred to for like a screening and setting the stage so that if it develops, then that individual knows exactly who to contact and can get involved in treatment very early.
So it's really any one of those risk factors?
Yeah, there's a few more, but those are the top 4. Yeah.
Great. Thank you. While I have you on the speaker, Dr. Perdomo, someone asked a question about Reiki. Do you have any comments on that in the oncology population?
Yeah, Reiki is an energy technique. I think here at Norris, we have therapeutic touch that's often performed by nurses. So it's just a form of energy interventions, just putting your hands over certain body areas and just mentally focusing on channeling energy to that patient. There's not a lot of research on it. There's a lot of anecdotal research, but through the nursing associations, they are putting the science behind Reiki. We could, you would probably have to Google, find a Reiki practitioner in your area. But a lot of yoga studios, a lot of their yoga therapists will be Reiki certified. And like I said, therapeutic touch through the nursing association.
Great. And Nancy Berman mentions in the chat that at Norris, we also have Reiki class offered to all patients free from a foundation. It is virtual at this time, and staff and patients are invited. Thank you. Also from Nancy, perhaps for Dr. Hardy, how do we know what herbs and compositions have things in their composition that can affect treatment? I think perhaps a similar question is, when you pick up a supplement, how do you know that what's listed there is truly what's in that, and that you're not getting also, like I've heard, there might be toxins in spirulina supplements. It's not, FDA regulated. How do you kind of go about assessing quality when we're addressing dietary supplements, herbs and botanicals? Oh, sorry, you're muted, Dr. Hardy.
Another hour-long discussion. So briefly, in terms of quality, I always say to people, look on the label. There's certain requirements that are there by law. If the label is inadequate or incomplete, if they can't get the label right, the odds that what they put in the bottle is correct is low, very low. That's number one. There are lots of adulterations that happen because of where things are collected. That's the issue of spirulina. If it's in water that's been polluted, then that'll be collected along with the spirulina, because the spirulina pick it up. So you kind of want to know where something's coming from and how clean the water is to start with. Certain kinds of supplements are more likely to be adulterated, and they're ones that are expensive or rare or uncommon herbs. So if something's the newest hot ingredient from the Amazon, that I've been there 8 times, so there's no roads past the water. So once everything is collected near the river, the odds of being able to get stuff way deep back in the jungle and bring it out in the superhighway, there is no superhighway. So and a very specific environment makes me more suspicious. A company that isn't a large company, that's not always true, but as a rule of thumb, that's true. And there are certain seals that are on products that will tell you if the product meets certain standards. So that's the USP seal of verification, the NSF seal of verification. Consumer Labs is a very good resource for your patients. That's inexpensive. That will talk about a lot of this. Now, in terms of how do you know if an herb is toxic, dietary supplements are relatively straightforward. They're single agents, they're simple chemical agents. Vitamin C, ascorbic acid, that's relatively simple. But even something like ginger, that's just a much more complex product. And also you have to remember that if you need an herb today, you had to think about it way back during its growing season. So you can't all of a sudden make more ginger. You have to let it grow in the ground. I mean, that sounds ridiculous, but when we see a rapid uptick in the utilization of an herb, then I can guarantee you that the herbs that are coming out are going to be contaminated. So when St. John's wort was first popular and everybody was talking about how great it was, demand increased 1,400% in 1 year. I can guarantee you that they couldn't meet the need for all the St. John's wort that was wanted. So other parts of the plant, besides the part that were particularly helpful, were put in capsules, and that gives the whole industry a bad name. So I will say that there is regulation that talks about the quality of manufacturing. And when there are breaches in that, the FDA can call them out, but they have a passive position. They have to wait for harm to be able to regulate. That's just a quirk of our law that's not particularly good. Now, I think to get back to the original question though, which was how can you tell if an herb's going to be toxic? Most of the toxicity of herbs in oncology is going to be related to herb drug interactions. And specifically, there is less of that than is promoted. So most herb drug interaction discussions are take potential interactions or theoretical interactions and give them the full weight of clinical effect. That's wrong. Or they'll take things that are done in vitro and then apply them to humans, or they'll have an animal model that's not predictive of human. So what we do know is herbs like St. John's wort, especially if it's high in hyperforin, that's a very messy herb. It's going to interact with a lot of stuff, and a better solution would be to use, for example, SAMe, acetylsalicylmethionine, for depression. It doesn't have the drug herb interactions. But a lot, and so when a patient is using biologics, things that are a bit more not as durable as Taxol, or if someone's dropping the bomb of Taxol on a patient, that's really hard. That's a huge effect. My little herb is not likely going to make the Taxol less effective. That's just so powerful. However, if someone's taking a biologic and I change the binding, or I work through the same cytochrome P450 system, I might change the availability. And sometimes even very benign things can cause a problem. There was a case report of a patient who was getting a biologic for a head and neck cancer, I think, and he started drinking a lot of green tea, and his tumor swelled, and it was less, and the less efficacy of his biologic was documented. He withdrew the green tea, his tumor came down, the biologic was working again. Now, that's not causal, but he did a re-challenge. So he really wanted to drink green tea. So he started drinking green tea again and got the same effect. So sometimes a difficulty can come where we don't expect it all the time. So look for patients who are using things you can't describe very well, things that are known to have human-based interactions, things that they're taking in excess dosages or in large amounts. That's a bad sign. Or when there is a low therapeutic index drug, or a drug that might be affected by a change in cytochrome P450 metabolism. So that's the short list of how to do that.
Just kind of related to that, we're getting a lot of questions on antioxidants and how it interferes with, let's say, chemotherapy or radiation.
It doesn't. Thank you for asking me. Can I answer that question? Thank you.
Yeah.
That's the study I showed you that was on micronutrients. That whole paper was a review of recent studies looking at a variety of different kinds of antioxidants, vitamin D and selenium mostly. In studies, there's one very famous study looking at head and neck cancers, looking at vitamin E, the antioxidant vitamin E, and it was given to groups of patients, and it showed that in the vitamin E group there was an increased risk of early recurrence and bad outcome. And you'd say, okay, throw the baby out the bathwater, the vitamin E, all kinds of vitamin E, done. But if you looked at a subgroup analysis that this group did not publish but was done later, showed that all the risk accrued to the people who continued to smoke during treatment. So vitamin E in a person who continued to smoke and get chemotherapy showed an increased early recurrence. Is that the smoking? Could be. Is that the vitamin E? Is a combination of two together? But vitamin E itself was not the villain here. So most of the direct evidence has been looked at in moderate amounts or in dietary sources. There has not been evidence of harm, including in radiation. So I think it's really worthwhile to put that myth to bed that this is all deadly, deadly, deadly. Because if you really believe that, your patients shouldn't be eating oranges, they shouldn't be eating fruits and vegetables. And we know, and Marisa was very good about talking about that these highly antioxidant rich food sources help with treatment, side effects, and well-being and general health. So I so don't ascribe to that.
Are there kind of, so you mentioned, antioxidant sources in the diet and moderate dosing is okay. Is there a level where you would feel that I think the argument here is that there's a hypothetical kind of cancer protective effect of antioxidants when you're on chemo or radiation.
Right,
And
right,
so,
right. What usually has been shown to happen is that the supportive therapy protects the normal cells that tend to get bopped by the radiation. So for example, if we use glutamine, there's a lot of controversy about that because glutamine in vitro studies has been shown to feed cancer growth. But what's not recognized is that the body the cancer has already oversubscribed and filled itself with all the growth agents that it can use. And the tissue that gets shorted are the tissues that are obligate glutamine users, like the cells lining the digestive tract. And so those cells end up breaking down much more quickly than they might have if you give them glutamine support. So it's a complicated area. There are times when you have to be careful, but I will say this, that even high dose vitamin C intravenously was not shown to affect cancer outcomes negatively. So it just means that we have to, anyway, so just that I think we need to be much more, we need to not act on our prejudice and act on what the data shows us, be moderate in our interventions, and then be willing to stand up and look and see what the outcomes really look like. And we need a lot more outcome-based studies where we look at the cancer rate, et cetera. But again, I'm reminding you, in patients with integrative, in patients who went to centers that had integrative oncology using all these things, they had a 3 times less rate of death in 5 years than patients who went to centers that didn't have this kind of work. So I think the burden is more becoming on the people who think this is a harm to prove it.
Speaking of accessing these services, both mind-body, acupuncture, integrative medicine, are any of these therapies reimbursable by insurance or Medi-Cal?
Yes.
Not a lot, though. Not a lot. Medi-Cal pays for 2 acupuncture treatments a month.
Yes.
That's
How much is kind of a normal patient burden? Say someone's going through chemotherapy, wants to get acupuncture for symptom support.
Medi-Cal is better than nothing, but it does, like Mary said, it reimburses two visits a month. And then the question is, where can you get a provider that's accepting that? But it's better than not having reimbursement at all.
2 thoughts. You could go to the student clinic at an acupuncture school, and they may have a special time when someone who knows about acupuncture and oncology patients are there. I would say if you're in Tucson, find Aaron and he'll be happy to put you in touch with his clinics, his student clinics. And then the other thing is, another way to deliver acupuncture, I think we have done less investment in, is to do acupuncture in chairs in a group setting. Now, guarantee that you can't do everything, but you can do a lot. And then with a large enough group and one practitioner seeing 10 patients, let's say, the cost becomes much more manageable. And I would encourage people to think about developing that. So
I agree. I agree with that. There was a program at the San Diego Cancer Research Institute, which was in Encinitas. It doesn't exist anymore, but it was a great program, and they had available acupuncture in a group setting. And yeah, I agree with that. Like the better, the more efficiently you can deliver the service, the better, essentially.
And I would say for yoga, there are a lot of cancer centers, these integrative cancer centers, that provide free yoga for their participants. I know there's a lot of community-based yoga programs for cancer patients. Like, for example, the Pasadena Cancer Community here has free yoga classes. But it's primarily restorative yoga. And then you can check with some yoga centers. Sometimes they have they usually have 1 or 2 times a week what they call a community yoga class for people who can't afford the regular price. and it's a reduced price. I know like the YMCA has yoga classes, so that is helpful in keeping costs down, but it is expensive. It's definitely expensive.
Irene, can we ask Toby Fischel to unmute herself? And she has an interesting comment to make, I think.
Hello, everyone. Thank you so much. I was part of a research study for a few years with Mount Sinai and a few other institutions in New York. And for folks who had no money and were on Medicaid or had nothing and they had cancer, we followed people who didn't get acupuncture and people who wanted to do acupuncture in a group setting. And there were 8 to 10 people in a room, just like Dr. Hardy is saying. And the patients who ended up taking acupuncture followed up with their care more often, were less depressed, less anxious, did better overall. It was quite phenomenal. And we've been publishing that for the last year, and I think a few other articles are coming out, but that the whole idea of the group community, as well as it's less costly, is really phenomenal. The patients talked to each other, they shared, and also got acupuncture. So it was a win-win for everybody. Thank you.
Thanks, Toby.
Really a lot of great resources in the chat, and we are at time, and there are so many other questions that unfortunately we just didn't have time to get to. Just want to send you or just let everyone know that we will be posting a recording of this as well as slides when available to our website, integrativehealth.usc.edu. It's in the chat again, so please find that as well as the resources. Perhaps we can ask offline some of our expert panelists some recommendations, say for online resources to find a practitioner or to check out an herb or botanical that you're interested in, and just making sure that it's safe to talk about with your patient or to offer to your patient.
Irene, really quick, can I just mention that there are so many free online videos of yoga sets and meditations and breathing exercises. You have to do a little investigation to see if it's appropriate for you. But given COVID and given everything that we've been through the last 2 or 3 years, there's such a volume increase of all these people putting up their yoga sets for free, you know, on YouTube and Google. So,
and Marisa, if you have any particular group that you think is generally good, that would be real useful to get a pointed in that direction if possible.
Yeah, I do think that there are a lot of if you look for restorative yoga, that would be the best and safest place to start. Mm-hmm. Because of the individuality of the complexity of everybody's physiological and musculoskeletal response to cancer and its treatments. It's kind of hard to give advice. You can't say what you can do, but at least you could look at some of them and then talk to your physical therapist or your occupational therapist or your healthcare provider to see what would be appropriate.
Mm-hmm. Terrific.
Well, a big thank you. Oh, go ahead, Erin. Well, a big thank you to our, sorry. Big thank you to our panelists. You were just incredibly generous with your time, with your knowledge, your wisdom. And thank you to our attendees. A lot of great questions as well as resources in the chat and the Q&A. This is truly a community and I'm excited to learn alongside with you all. Please stay tuned for the next.